Welcome to Virtual Family Training for Immigrants. The instructors in the Finnish Virtual Family Training are Public Health Nurse Jasmin Kaljadin and the peer instructor Kela from Albania. This Virtual Family Training is part of the peer-based family training model for immigrants of the Need to Project, which is coordinated by the Tampere University of Applied Sciences with the city of Tampere acting as its partner. The project is funded by Asylum, Migration and Integration Fund, AMIF. It will run from 2018 to 2020. This section of the family training deals with the different stages of labor and the pain relief in the hospital. We will explore the first stages of the baby's life after birth and the transfer to the maternity ward. We will hope it will provide you with useful information on your journey towards the birth and your everyday life with your baby. When you arrive at the hospital, you will register either by using the hospital's self-registration machine or by going to the registration desk, depending on the hospital. At the hospital, a midwife will ask you questions, measure your blood pressure and carry out other examinations as necessary. The midwife will also perform external and internal examinations. The fetal heartbeat and your contractions are monitored using sensors that the midwife will attach to your stomach. The fetus heart rate and your contractions are monitored using a cardiotogography (CTG). The results of this monitoring will help the midwife to determine how far labor has progressed. If labor hasn't progressed enough to proceed yet, you will be advised to stay at home or in the hospital. If labor is well underway, you will go directly to the delivery room. In Finland, the midwife usually handles the delivery from start to finish. A doctor is only requested if needed. You can take one support person with you to the delivery. Often, this person is the pregnant woman's partner. A child's birth is a unique experience for both parents, which is why we recommend that your partner comes with you. Then both parents can become acquainted with their baby straight after birth. The support person can also be someone else who is close to you. You can't take children along to the hospital. The support person plays an important role during delivery. The support person's presence is reassuring for the mother and brings her a sense of security. The support person can ease the mother's contraction pains by helping her to find a comfortable position, stroking and massaging her and gently pressing her pain spots. If needed, the midwife will tell the support person how they can help the mother. Ask the mother how she wants you to help her. The majority of childbirths are regular vaginal births. A vaginal birth is the natural and primary way to give birth. It's usually the safest way to give birth for both the mother and the baby. The mother's recovery from a vaginal birth is usually quicker than after a C-section. In a vaginal birth, the mother passes on good bacteria to the baby that will help the baby to form strong immune defenses. During a doctor's appointment at the maternity clinic in the last few weeks of pregnancy, the doctor will assess the best methods of childbirth for the mother and, if necessary, will refer the mother to the hospital. Sometimes a C-section may be considered a safer option for the mother or baby. This assessment is always made by a hospital doctor after careful consideration. The following sentences are peer instructor's personal experience. The mother's relatives or partner may think that a C-section is a better way to give birth, but in Finland this decision is always made by a doctor. Labor is divided into 3 stages: dilation, the pushing phase, and the delivery of the placenta. We will now examine these stages in more detail and talk about what happens in each of them. The first stage is the dilation, when the neck of the womb, known as the cervix, opens. This is the longest stage of labor. The first stage consists of the latent phase, followed by dilation. The latent phase is a normal part of labor and may take many hours or even days. The duration of the active dilation stage is approximately 8 to 15 hours for first-time mothers, and often less for women who have given birth before. During the dilation stage, the cervix opens fully to allow the baby to be born. As the cervix dilates, the baby moves lower into the pelvic region and into the birth canal. Drug-free pain relief methods can be used throughout the delivery and both at home and in the hospital. Drug-free pain relief is discussed in more detail in part 1 of the virtual family training on labor. Medical pain relief options are discussed in the following slides. The midwife will help you choose a suitable method of pain relief. At the beginning of labor in the hospital, it's common to use strong pain medication that is injected into a muscle. Pain medication is injected into your arm, thigh, or buttock muscle. Often, pain medication promotes the advancement of labor. Sometimes, contractions pause when pain medication is given, and this will give you time to rest and relax. A mixture of oxygen and nitrous oxide is a pain relief gas that you breathe in. The midwife will instruct you in how to use it. Put the mask for the gas tightly on your face as soon as you feel a contraction begin. Breathe deeply and slowly. You should have the mask on your face throughout the contraction. The gas can be used throughout labor. Your support person can help you keep the mask on. Epidural and spinal block are local anesthetics injected into the lower back. Epidural is commonly used for first-time mothers. Spinal block is used more with women who have given birth before and when labor is progressing quickly. They are injected in the lower back. Labor must be well underway before these can be injected. When anesthetic is injected into your back, a drip will be placed in your arm so you can be given fluids, and your condition will be monitored more carefully. After the injection, it's often still possible to move. The midwife will give you more instructions. Other local anesthetics are paracervical block, which numbs the cervix, and pudendal block, which numbs the area between the vagina and the anus. Paracervical block is injected during the dilation stage, and pudendal block is injected via the vagina during the pushing stage. Both blocks take effect quickly. The second stage of labor is the pushing stage. The pushing stage begins when your cervix is fully dilated. The baby has moved down into the birth canal, and the mother often feels the need to push. At the pushing stage, the mother pushes strongly during a contraction to help the baby to be born. The midwife will be with you throughout this stage. The pushing stage takes anything from a few minutes to up to 2 hours and ends when the baby is born. If needed, an episiotomy is performed at this stage to help the birth of the baby. There are many different positions for pushing, and it's a good idea to practice them beforehand. The most common position for giving birth is reclining. You can also give birth lying on your side. Some women prefer squatting, but this position requires fitness and cooperation with a support person. You can also give birth on your hands and knees or on a birthing chair. The support person plays an important role in physically supporting the mother in a suitable position during delivery. The midwife will help you to find a suitable position when you need to push. The last stage of labor is the delivery of the placenta. At this stage, the womb is contracting strongly, and the mother will usually deliver the placenta within an hour of the birth. The mother is injected with a contracting drug known as an ecbolic to prevent additional bleeding. If needed, any tears and episiotomy cuts will be stitched up under local anesthesia. After the birth, the baby will be put on the mother's chest for skin-to-skin contact. Skin-to-skin contact helps the baby to adjust to life outside the womb. The umbilical cord is cut a few minutes after the baby is born. The support person can cut it if they want. After the birth, samples of the umbilical cord are taken and the baby is given a vitamin K injection. After childbirth, the midwife assesses the baby's condition and performs the Apgar test at 1 and 5 minutes after birth. The first breastfeeding takes place in the delivery room. The baby is measured and weighed. The baby isn't washed but can be wiped if necessary. The baby and mother will be monitored in the delivery room for 2 to 3 hours after the birth. If necessary, a pediatrician will examine the baby straight after birth. The following sentences are peer instructors' personal experience. Sometimes people find it surprising that in Finland the baby is given to a parent straight after birth without being washed. The father can also hold the baby in his arms. It's important for parents to have a chance to get to know their baby in peace straight after the birth. The family is usually transferred from the delivery room to the maternity ward. The health of the mother and the baby is monitored at the ward in various ways. The parents are given advice on baby care and breastfeeding. Often, the mother and baby are discharged on the second or third day after the birth. Before the discharge, a pediatrician will examine the baby. When you have returned home, please call the maternity clinic the following day at the latest. You will be sent an invoice for the cost of treatment to your home address. This charge is collected for every day you stayed at the hospital. Childbirth costs approximately 40 to 50 euros per day. Low-income families may be eligible for financial support towards this charge. Sometimes delivery doesn't go the way we have described it here. Such a case is known as an irregular birth. Irregular births include premature birth, ventrous delivery, breech birth, and C-section delivery. A doctor will accompany the midwife at such deliveries. There are often other personnel present to assist in the delivery. The birth is premature when the baby is born before week 37 of the pregnancy. If you go into labor before you have reached week 37, contact the maternity hospital immediately. The purpose of Ventau's delivery is to help the baby to be born when the pushing stage has stopped and the labor is no longer progressing. The doctor will attach a suction cup on your baby's head, creating a vacuum. During a contraction, the mother will push and the doctor will gently pull. This is to help the baby to be born. After a venous delivery, the baby will often have a small bump on the head that will disappear by itself in a few weeks. In a breech birth, the baby is lying bottom or feet first in the womb. Breech deliveries are rare. Usually the breech position is discovered during pregnancy at the maternity clinic and the mother is referred to the hospital. If the fetus is in a breech position, the delivery will be planned carefully. If vaginal birth is not possible, a caesarean section will be planned. In a caesarean section, also known as a C-section, an incision is made in the mother's abdomen through which the baby is removed from the womb. A C-section is made under local or general anesthesia. It may have been scheduled beforehand or it may become necessary during labor. Unscheduled C-sections are divided into urgent and emergency caesarean sections. With an urgent C-section, there's more time to prepare for the procedure, while in an emergency C-section, the baby will be born in a matter of minutes. Often the support person is allowed to accompany the mother during a C-section birth. The baby is usually put onto the mother's chest or the support person's arms for skin-to-skin contact for a moment. The reasons for a caesarean may include, for example, the mother's hip being too narrow, the placenta totally covering the mother's cervix, the fetus breech position, and the strong fear of childbirth. Situations may also occur during labor that make it necessary to perform an urgent or emergency C-section. These include, for example, the fetus' lack of oxygen or an abnormal position. In Finland, approximately 15% of deliveries are performed with a C-section. Childbirth is a natural event and the majority of deliveries go very well. Trust yourself. Professional midwives will help you throughout the delivery. It's natural to be nervous about childbirth. This is a topic that the nurse at the maternity clinic will talk to you about. If you have any questions about the topics discussed here, please talk to your public health nurse at the maternity clinic. We recommend you also see the other videos and brochures produced within the Need to project. Some of the videos are available with Finnish, Arabic, English, Persian and Somali subtitles. Some of the brochures have been translated into Finnish, Arabic, English, Persian and Somali. The employees of the Need to project wish you a happy pregnancy and all the best with your delivery.